Hello, everybody. Well, this is going to be a little different than what I normally do. Normally, I script out a video and then script it, put up the visuals, and make a video. And, I have one specific point that I'm addressing. I'm going to call this my bloody sleeve blog. I'm sure you're familiar with the term putting your heart on your sleeve, putting your heart on your shoulder. I don't know. Basically, when you put your heart on your shoulder, you're putting your thoughts out there, and you're basically allowing someone to knock it off. So if I put my heart on my shoulder, put my heart on my sleeve, putting myself at risk of being criticized and whatnot. So this is my putting my heart on my sleeve, if you will. So it's my bloody sleeve blog. Essentially what I wanted to do is just talk out some things that, I don't know, some other people might have experienced as well. I want to start off by saying this. Never criticize anybody for talking to themselves. I'm going to instruct the world, tell you what to do. I'm going to tell you, do not criticize or judge someone for talking to themselves. When you talk to yourself, you're doing exactly what you do when you go to a psychotherapy session. During my nursing training, we learned what the best treatment was for many, if not all, psychological problems, psychological diagnoses. When you go to a psychotherapy session, basically what you're doing is you're just talking out loud. You're taking your feelings and you are putting them into words. The psychotherapist's job is essentially to ask leading questions, ask clarifying questions, and just be there as a listener. And your objective in going to a psychotherapy session is to basically just put your thoughts into words to clarify the situation. It's free. It's completely free to just talk to yourself, okay? Now, if you think about it, when you talk to yourself, I think most of us do it. We just don't do it in public and nobody knows. And when I say don't judge anybody, not only is it because you probably do it yourself, but also you are the only person in the world who knows exactly where you're coming from and what you mean. I think we should all talk to ourselves more often. Because what you're doing when you're talking to yourself is you are doing exactly what you do during a psychotherapy session. And all the studies that I've seen during my training and the textbooks and whatnot, they all basically say the same thing. Drugs to control a psych problem are not as effective as psychotherapy. Psychotherapy is, like I said, you're just talking. You're just taking your thoughts, you're taking your feelings, and you're turning them into words. And then putting them out there, they become a lot more clear. And you understand what you're doing. And you get that moment of zen. You get that sense of clarity for why it is you feel a certain way. So this is basically what I want to do. Just talk out my thoughts, talk out my feelings. And I think everybody should do this more often. We should make it a habit. Everybody should talk to themselves frequently and in public. Everyone should look like a crazy person. We're all crazy to a certain extent. I want to talk about something that I think is very misunderstood in the world of psychology and psychiatry. I'm sure everybody is aware of Scientology. Scientology is a religion created by L. Ron Hubbard. He essentially took his ability to write fiction novels and he created a religion. And people fucking follow it. That's the crazy part. But anyway, it's extremely anti-psychiatry. I'm sure everybody is familiar with the actor Tom Cruise. Tom Cruise is a crazy person. I think we can all agree. He had that comical episode of jumping on the couch because he's so in love with whatever his chick's name was. He's so in love, so he's jumping on the couch during an interview with Oprah Winfrey. And he's super anti-psychiatry. I remember one of our assignments was to actually watch an interview with Tom Cruise, and basically the interview that we watched was to observe a case study in a psychological illness, watching this actor spew hatred for the science practice of psychiatry. It was pretty amusing and very ironic, the whole thing. Psychiatry and psychology are practices of medicine which diagnose and treat psychological illness. That's what it is. Now, something that a lot of people don't understand about psychiatry and psychology. You hear people talk about ADHD this, they're over medicating our children, and that is true to a certain extent. Parents take their children in for bad behavior to a psychiatrist, And the psychiatrist, in the best tradition of medicine, listens to the parents, listens to the child, formulates a diagnosis, and prescribes a drug. That's what psychiatrists do. Psychologists, on the other hand, are doctoral prepared clinicians, and they do more of the psychotherapy side of things. Okay, that's their mainstay of treatment. Psychiatry, their mainstay of treatment is drug suspension, basically. They find out what the appropriate drug is based on current research, best practice, and they prescribe a certain drug treatment. So you have these two types of treatment modalities, and they're basically different philosophies of the same, they're two sides of the same coin. They're two different treatment modalities. Psychology mainly prescribes psychotherapy, which is actually better supported in the literature for being a better treatment long term, and psychiatry prescribes drugs. That's basically the two types of treatment modalities inherent to those two different types of practices. Now, the most misunderstood aspect of psychiatry and psychology is when they give you a diagnosis, it is not the same thing as diagnosing an infection. It's not the same thing as diagnosing a physical ailment. Okay? When you have ADHD, when you have schizophrenia, depression, when you have any kind of psychological diagnosis, okay, I'm specifically saying diagnosis. When you get a diagnosis from one of these clinicians, they are not telling you something that you have. They're not telling you that you have something like a tumor that can be excised. They're not saying that you have a physical limitation. Diagnosis of psychology and psychiatry are not the same thing as a medical diagnosis. It is a psychological diagnosis. To understand the diagnostic process of these two sciences, you have to understand the objectives of those two sciences. If you look at the DSM manual, or the DS manual, the Diagnostic and Statistical Manual of Mental Disorders. To come up with a proper diagnosis, you have 5 different axes. They're called axis 1 through 5. And essentially it's kind of like layers. For example, axis 1, all psychological diagnostic categories except mental retardation, personality disorder. That's axis 1. Okay, that would be the axis 1 diagnosis. Axis 2, personality disorders and mental retardation. See, one is excluded to axis 2, and the rest are excluded to axis 1. Axis 3, general medical condition, acute medical conditions, and physical disorders. So basically that adds to the diagnosis. Axis 4, psychosocial and environmental factors contributing to the disorder. And that really says a lot for what this diagnostic process is. It says contributing to the disorder. Psychosocial and environmental factors contributing to the disorder. Axis 5, global assessment of functioning, or Children's Global Assessment Scale for children and teens under the age of 18. That is your spectrum, your axes of diagnosis. So once they've come up with what the problem is, then they have to say this is the right treatment for this thing, okay? And they use different studies to determine what the right drug. If you're a psychiatrist, if you're a psychologist, they determine whether or not you need to go see a psychiatrist, or whether or not you need to get referred or accept psychotherapy modalities for treatment. Now, to understand what the objectives are, the clinical objectives in psychiatry and psychology, you have to understand that this is all about quality of life. Now, with every single diagnosis, there is a time profile. This has been happening for over 6 weeks, for example. This is really affecting my life. I cannot function in my normal life because of this disorder. Okay? So understand, when you have a psychological disorder, it's not saying you have a tumor. It's not saying you have a physical ailment. It's not saying you have this thing that you can carry around with you, put in your back pocket and say, this is what I have. I have depression, and use that as your excuse for this or that. That's not how psychiatry and psychology work. Psychiatry and psychology, the objective is to make it possible that you can function in your normal everyday life. Okay, so let's say that you have major depressive disorder. If you have major depression, they will diagnose it using using the 5 axes, and they will prescribe a certain drug. Let's say they prescribe a stimulant. Maybe they put you on Adderall. Maybe they put you on testosterone. Sometimes men with low testosterone, after they've had a blood sample taken and analyzed, they'll say, you have low T, so I'm going to prescribe you a testosterone patch. And a lot of times, if they correct for an imbalance in certain hormones, that will actually improve the situation, and you will no longer feel like you can no longer function in your everyday life. If you have major depressive disorder, that can be extremely limiting. Okay, if you have ADHD, real ADHD, not simply a parent seeing a child can't behave in class. When you have real ADHD, you can't function in your normal everyday life. Okay, when you have a post-traumatic stress disorder, this is a disorder which says, I cannot function in my normal everyday life and I need help. That's what it is. If you have a psych disorder, let's say you have post-traumatic stress disorder. Let's say that your parents died suddenly in a car wreck, and you can't function because you go to school, and all you can think about is going home to an empty house. All you can think about is going home to these people that you don't know, your new parents, your adoptive parents, or going to the group home or whatever, and you hate your new situation and you can't function. So you might go to a psychiatrist and they might say, okay, you need something to help you calm down, an anxiolytic drug. You need something to help you sleep better. They might take those axes, those 5 axes, and they might say, okay, the best drug for this is, I don't know, Prozac. Let's say you take that drug and it takes the edge off just enough so that you're not constantly fidgeting, you're not constantly worried and frustrated, you're not constantly, your mind's not gripped anymore in this haze of anger and frustration for your new situation. Let's say that you have major depressive disorder. You are so depressed, you just don't care. It's called anhedonia, or you feel anhedonic. You just don't care about happiness. Nothing makes you happy. Nothing makes you satisfied. You're so frustrated with life, and you just maybe you want to commit suicide. Maybe you just want to end it all. That is so mind-numbing and frustrating that you just can't function. Going to school, going home, doing homework, cleaning the house, doing basic hygiene. Maybe you're so depressed that you don't care about feeling better. You don't care about having a clean mouth and teeth. You don't care about cleaning yourself, and you end up in this cesspool of filth. You go to a psychiatrist, he gives you a medication, and that just takes the edge off. That's the real objective of psychiatry and psychology. If you have ADHD and you're so distracted constantly, you can't focus on anything. You have piles of trash outside. You have the dishes that are stacked up in the sink. You have your room, your living conditions are just a wreck, but you are so overwhelmed because you can't focus on anything, and so you just can't do it. You sit there and you just do something else. You just focus on something else. So you go to a psychiatrist, he prescribes you something, I don't know, Ritalin, and you come back and it helps you focus. It takes that edge off. And then you say, okay, I can do the dishes now, I can do the trash now. And eventually, step by step, you build up your living conditions and you do basic hygiene and you fix it. You fix it. What those drugs do is they take the edge off. They help you refocus. Okay, maybe testosterone, like I said. Maybe testosterone gives you a little more motivation, just enough to get you moving. And then you fix your situation, and now everything's much better. That is the real objective of psychiatry. Psychiatry and psychology are not about curing an ailment like taking an antibiotic, curing a real disease. Okay, these are not real diseases as we think of them. These are psychological inhibitions. These are psychological situations which keep you from doing your what we call ADLs, activities of daily living. These are the normal everyday actions that we all need to do to maintain a normal standard of living. When you have a psych problem, a psych disorder, it is not a disease. Anybody out there who has a diagnosis of depression or whatever, you cannot use that as an excuse. You cannot say, I have depression, and therefore I have a disability. Like, if you have renal failure and you have to go to the dialysis unit 3 times a week for the rest of your life, that is a real disease. That's something that will kill you if you don't get constant treatment for the rest of your life until maybe you have a transplant. Maybe you get on the list and you get the transplant. A psych problem is not the same thing. So when people disregard psychology and psychiatry, it is completely unfounded, honestly. It is completely false to disregard psych problems. Not because these are not real diseases, because honestly, they're not real diseases. What they are is disruptions in your ability to carry out your activities of daily living. So yeah, treatment for ADHD, treatment for depression, treatment for post-traumatic stress disorder, they are absolutely necessary. But the thing that the patient often misunderstands is that when they get these diagnoses, you can't use that as a crutch. You can't use that as an excuse for saying, well, I have this disorder now, and therefore, no. There is no therefore. I have this thing, I have this inhibition, I have this frustration that I can't deal with, and I need something to help me. I need some kind of thing to help me take the edge off. Maybe you have a bad memory. Maybe you were sexually abused as a child. Okay, you wouldn't call that post-traumatic stress disorder. Sometimes you might, depending on your clinician. Maybe you have some kind of diagnosis as a result of that. Okay, and so you need to go to psychotherapy sessions. What those do is help you to take the edge off. It helps you clarify the situation. These disorders are very real, and if they really do disrupt your ability to carry out your activities of daily living, they can be extremely intrusive, and these disorders can keep these normally healthy people from staying healthy. Okay? The mind is the control mechanism of the body. It makes you go, it controls your muscles, all that stuff. But if the mind is affected to the point where you're unable to carry out your activities of daily living, it can be as debilitating as a real disease. That's the thing that people don't understand about psychiatry and psychology. When you get a diagnosis from a psychiatrist, the diagnosis is essentially saying, this is the proper drug that can treat this, or at least according to the literature. This is the proper therapy that this person needs, or that might help this situation. Because once you're able to carry out your activities of daily living, not that you walk around high all the time, that's not the objective. The objective is not to make you happy. It's just like a pain medication. You don't give a pain medication. See, I'm a nurse, right? So when I give a pain medication to a patient, my objective is not to make them pain-free. That's a misunderstanding. I am not trying to make them pain-free unless, for example, I'm withdrawing care, which means we're letting a patient die. If I'm letting a patient die, I want them to be pain-free. I don't want a patient to be pain-free using a pain medication. I want the pain to be controllable. I want the pain to be limited to the point where the person is able to function. That's the point. It's called quality of life. You want to do some treatment. You want to prescribe some treatment which allows the person to have as normal as possible, a normal quality of life. Drugs do not fix the problem. Drugs augment the problem. That's the thing I think that a lot of people misunderstand about psych disorders, psych diseases. They're not diseases, okay? We're going to be straight about this. Psych disorders are not diseases. Psych disorders do not give you an excuse to continue to wallow in suffering. Okay, you can really suffer because of a psych disorder, but it is not a disease as we classically think of disease. It is a disorder which, if you have a drug, which allows you to overcome it, which allows you to take the edge off and continue on your normal path, your normal everyday activity, that's really the objective of a psych disorder treatment. Alright, so now that that's out of the way, talking out loud and describing your feelings, describing your thoughts is extremely powerful for the benefit of the person talking. Basically, I guess today I just wanted to talk about the results of growing up in a religious home. When you grow up in a religious home, it is no different from religion to religion, cult to cult, okay? Cults, they keep you, cults are basically religions on steroids. Cults, yeah, they make you gain weight and they cause you to develop cysts and to eventually have liver failure. No, not on steroids. Cults are basically religions exponentially affecting their laity, their followers. Far more intrusive than your classical religions, your traditional religions like Christianity and Islam and whatever. Basically, when you're brought up in a religion, for those who have not been brought up in religions, what happens is that you start off life with your parents in charge of you. Okay, let's say, for example, let's set up a scenario. The parents entered the religion voluntarily. They found solace. They found happiness and love and acceptance within this religion. They found a structure which they can follow, and as a result, they feel like somebody cares about them or whatever. For whatever reason, they joined this religion, and now they have children, and they're raising their children up in this religion. Children that are brought up in the religion start life off with that religion as their basis for understanding life and everything in it. What's interesting is that along with religion comes certain absolutes. Certain things that are simply non-negotiable. I'm talking about this in a very broad, statement, but taking the example of a Christian home, I was raised in a Christian home. When I was a very young child, I was raised to understand that the world is created by God, Yahweh, whatever. And his son is Jesus, who is actually him, and the Trinity doctrine and whatnot. I was raised to understand that this just is how things are. This just Christian worldview is the way the world works. It just is. And when you're brought up with those assumptions taught as facts, and then you leave that compound, that cloister of people which constantly condition you to accept this as true, what's happening is that you leave this and now you're so confused because you're like, what the fuck? You get out and you learn about science, you learn about evolution, you learn about physics, you learn about world history. I was raised in this religion, and now when I get out, I find out that they're completely wrong about the majority of what they think is factual, what they think is true. It's not. But I, being a child who exited this cloister, I find out that it's not. Now, here's the thing about religion and how it affects young minds. Young minds come out of this cloistered environment and are introduced to the world, and we have this concrete sense of reality. And now we're being introduced to this outside world. The outside world is telling us that no, what you think is true is actually false. Now, here's the thing that you really need to understand. Being raised in a religious home, you have certain absolutes which, if questioned, have certain consequences. If you decide that you no longer believe, to you, based on your classical conditioning, you actually think you're going to go to a place of eternal torment. There really is no such thing as eternity, because if you think about it, time is a progression. Right? Time is the fourth dimension. Time is the 3 dimensions, and then the next 3 dimensions, and the next 3 dimensions, and it's a progression. That's the way I understand time. I know that it's far more in depth. Time is this progression of these slices of reality, and it just continues and continues and continues. Now, the concept of a progression to infinity ad infinitum doesn't really make sense. It's not a real thing, though we can imagine it to be real, but it's not something that really jives with what we observe. So when they say eternal torment, it really doesn't make sense, honestly. But the thing is, in the mind of the believer, in the mind of the child that has finally exited and freed himself from this cloistered environment, he has this concept of eternal torment. It is terrifying. Fucking terrifying. I really need you to understand how fucking terrifying it is to have this concept ingrained in your mind. You finally escaped this, and now you are getting all these mixed messages. You're getting the world telling you you're wrong, but the consequences of you being wrong are so incredibly stark. They're so incredibly powerful. When you say, I no longer believe, what does that mean? That means that you are signing your eternal death warrant and you're aware of it. Okay, and now, if you really still have this concept, this concrete structure in your mind, you're expecting to have all those things that were told to you and reinforced to you as you were growing up. You're expecting all those things to happen. It is so incredibly terrifying to the mind of the young child who finally escapes this religious cloister. But once you finally escape it, the thing that really frustrates me more than anything is the lost time. Because you're constantly fighting yourself. You're constantly telling yourself, no, 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 I can't do that. I cannot disregard my religious upbringing. You're terrified. Fucking terrified. You can't. Because the consequences of disregarding your religious upbringing are so incredibly serious. You get all this imagery. I'm sure everybody's seen wood carvings from the Middle Ages. I'm sure everybody has, seen the Left Behind series or whatever. There was this one series called Thief in the Night, the Book of Revelation come to life. Similar to the Left Behind series. It was like in the 1980s when this thing was made. You're told that everything's out to get you. You're told demons are there and all this stuff going on behind the scenes that you can't see, you can't access, but you just assume it. You're told and reinforced that this is really going on. Once you finally break yourself out of that, I can't tell you, I can't even describe the incredible freedom that follows. The amazing thing is that nothing really changed. It's just your awareness. Your psychological state has now changed, and you no longer assume, you no longer have this concrete structure in your mind that simply can't be questioned. So when you finally escape and you finally give up that religious structure, it's incredibly liberating. Still, you're left picking up the pieces. You're left looking back on your life and you're realizing just how much you missed along the way. So, I don't know, this is my first attempt at a video blog, I guess. I hope that it was at least somewhat entertaining and enlightening. The bit about psychiatry and psychology was basically just to explain that when you talk to yourself, it's actually a very, very powerful form of therapy. It in fact is what therapy is. So I would encourage anybody listening to go ahead and start talking to yourself. I would encourage you to talk out your problems, talk out your feelings out loud to yourself. If you're nervous about being seen, do it, alone. But when you talk out your feelings and talk out what you're thinking and feeling, it is really a very powerful form of coping. And you can actually help yourself. If you're depressed, if you're frustrated, if you're angry, if you're feeling traumatized in some way, if you simply talk out your feelings alone to yourself, you will find an incredible liberation by doing that, because it's exactly what you'd get by going to a therapist. But anyway, I hope that this was at least somewhat entertaining, and thanks for listening.